Hey everybody. Well, it's right at the top of the hour, so I was thinking it's good time to get started. And welcome. My name is Sarah Flynn. I work with Innovative Biopharma. We're the company helping the FCS Foundation put on today's event. Thank you all so very much for everything you've done to help us get where we are today. And we are so excited for a great meeting. Next slide, please. I just wanted to take this opportunity to do a couple housekeeping notes with you. I know we've all been on Zoom. We might even have some Zoom fatigue going around. But nevertheless, there are just a couple helpful things that I wanted to mention to you. The first is you should see our slides up on your screen, wherever they are. There's a bar. If you were to view in gallery view right now, there's a bar that is connecting the slides and our pictures. You can pull that forward to the right or to the left and make the slides bigger or smaller as you wish, which is really helpful, I think, so you can get to really see the content of the slides when need be. And I would just ask at this point in time, we'd love to make it feel like we're together in a room as much as we can. Certainly that would be the goal, and we're making virtual meetings work. So if you could turn your cameras on as much as possible, that would be terrific. Having said that, if you don't mind muting yourself just to help reduce any ambient noise or interruptions, that would be terrific also. This entire meeting, we are going to be presenting some content to you. However, it's designed to be interactive. So at the bottom of your screen, you'll see that there's a chat function. That button is fun because you can see either chat to everybody or chat to a given presenter. So it's up to you, but you can write in comments or questions. At designated times throughout today, these next 2 hours, we'll have a Q&A, but then also at the end, we have a designated time to answer all of your questions. And of course, that chat feature, you'll see my name, Sarah Flynn. Please chat with me if you need anything, if you have any technical trouble, I'm here to help you. And with that said, it is my pleasure to turn things over to the FCS Foundation team. Take it away, ladies.
Hi, everyone. I'm Melissa Getz. I'm the co-founder and the co-president of the FCS Foundation. My daughter, Juliana, was diagnosed with FCS. I can't believe it, but almost 8 years ago. It'll be 8 years in February that she was diagnosed. She was 7 weeks old, and she had pancreatitis, a liver and a kidney infection. Her triglycerides were about 27,000. So that's how I came to be involved with FCS. And when I met Lindsey, who will introduce herself, after we met, we realized the need for the foundation.
Thank you, Melissa. Hi, everyone. Thank you so much for being here this morning. We're really excited about this program. I'm Lindsey Sutton, and I'm the co-founder and co-president of the FCS Foundation and also a patient. I was diagnosed at just 5 weeks old. And so when I met Melissa, we knew we had to do something, and we started the foundation together in 2016. So thank you so much for being here. Next. Our meeting objectives today, you will hear from our industry partners. We'll have updates from them, ways that we can engage as a community, and we will be providing you tips for a healthy holiday. Next.
I guess I'm next in the FCS Foundation.
Oh, no, not yet, Fred. I'll let you know. Thank you, though. Our agenda today, we will have introductions, an update from Arrowhead Pharmaceuticals, Axia, and Ionis Pharmaceuticals, Backpack Health, and then you'll hear from a dietitian, Mary Felando, for ways to eat healthy over the holidays, and an interactive Q&A. Next. I'm going to take a minute to introduce our board of directors. As I mentioned, I'm Lindsey. I am a patient with FCS, diagnosed at 5 weeks old. My triglycerides were over 30,000 at that time. Since then, I've had over 30 attacks of pancreatitis, and I manage with medication, diet, and exercise. Melissa, if you would like to say a few words.
Sure. So we're located in Albany, New York. I realized I didn't say that when I introduced myself. Juliana who hopefully will pop on again. She was here, but it's hard to keep a 7-year-old engaged here. She was diagnosed when she was just an infant, and luckily we received a diagnosis for her pretty quickly, so we were able to modify her diet and formula and things like that. But it wasn't easy. It was definitely a struggle, and there's, no standard of care necessarily for infants diagnosed. So that was very stressful. And at the time, there was absolutely no information that I could find except some journal articles that went pretty over my head. So when I met Lindsey in 2015 and we were able to connect, it was pretty life-changing. And we've been able to keep Juliana pancreatitis free. I'm knocking on my wood desk that I'm sitting at right now. And hopefully through diet, we can continue to do that. But it's just really nice to be able to connect with other people who have FCS.
All right, Young, if you would like to take a minute to introduce yourself.
All right. So my name is Yang. I'm kind of responsible for the tech side of the foundation, maintaining the website, and also I created the Facebook group, which with the goal to have a place for people to find us. And luckily, that's for the past few years we started from like a single-digit membership. Now we have more than 100. I was happy about that. And personal history with FCS, I was born, with this. Of course, everybody with this disease is born with this. But when I was very young, I got hospitalized, and in my 20s, I did some research, figured out, I might have this thing, and it's really, really hard to pronounce the words, and then in my late 30s, then I really find the diagnosis confirmed by gene testing. So yeah, it's a long journey, and I'm happy I'm here with a group of people here. So that's it.
Thank you, Young. Fred, if you would like to introduce yourself.
Good morning, everyone. Nice to see a lot of friendly faces I see out there. Christian, Christina, and all these good faces. Wonderful to see everyone. I'm Fred Soremi. I live in Mission Viejo, California. This is in Southern California, 70 miles south of LA, or downtown LA, I should say. And I guess my diagnosis was that I just knew I had high triglycerides. We didn't know what it was. That was in the early 80s. So I modified my food, lower fat diet and exercise. But then things got progressive reversement onwards in my 50s, about 20 years ago. I'm 71 years old, for all those young folks out there, so you will not die from this disease. And I'm in good shape. Just to let everybody know, I swim every day about half a mile in a swimming pool, and I do it in 25 minutes or less. So not too bad for an old man. So I keep very low diet of fat, watch what I eat. And on top of that, I also have the diabetes type 2, or technically called type 3C. I've been on the drug trials, and they were great. They helped quite a bit, lower my triglycerides. My triglycerides are nominal, about 2,500. They're moving up a little bit to about a little bit less than 3,000. Other than that, I've had my share of pancreatitis and the same stories that everybody has had, from vomiting and diarrhea and all those health things you go through every day. But I've been managing my life, but you live through it. There is hope for all these new medications, the new medication that's come up, and hopefully we get a chance to be on it. It's nice to see everyone, and I'm glad to be part of this organization. I'm a treasurer for this organization. Started with Melissa and Lindsey, and glad to serve you the best I can. Thank you.
Thank you, Fred. And Darlene, if you want to introduce yourself.
Hi, everyone. I'm Darlene Ball. I'm the secretary for the FCS Foundation, and I'm also a patient with FCS. I was diagnosed as an infant around 4 or 5 weeks old. Similar story to Lindsey and Melissa's daughter, where my triglycerides were up over 20,000, and really they didn't know what to do with me, much like all of you. I'm very happy to be a part of the FCS Foundation. I really look forward to this presentation. And I think, like most of us, we all struggle day to day with the diet and the restrictions, but it can be manageable. And there is hope in the future with some new medicines coming our way finally. So good to see you.
Thank you, Darlene. Next. And the FCS Foundation is extremely proud to have a medical advisory board. And on the call today, we have Mary Felando, who is a registered dietitian nutritionist. And we have Dr. Ahmed, and I will who is a lipid specialist, and I will let them both introduce themselves. Also on our board, who are not here today, unfortunately, is Dr. Rosenblatt, who's an endocrinologist, and Dr. Singh, who is a pancreas specialist. So Mary, if you would like to introduce yourself, that would be wonderful.
Hi, everyone. I'm Mary Felando, and nice to be here. Always happy to talk about food and low-fat eating and any way we can do it to make things taste good and enjoyable for all of you.
Thank you, Mary. And Dr. Ahmed.
Hi, I'm Zahid Ahmed. I work at UT Southwestern Medical Center in Dallas, Texas. And our lipid clinic there, well, let me say I'm an endocrinologist who specializes just in lipid disorders. That's all I do. And our lipid clinic focuses on, especially on people with rare genetic diseases. And so FCS is one of the ones that we have a good bit of experience with. And I have to say, it's really an honor to be part of an organization like FCS Foundation. It's really great to interact with patients outside of clinic too. And so I'm very happy to be here.
Thank you so much. We're really excited to have both of you on today. Thank you for making the time. Next slide. All right, Melissa, if you would like to take it away.
To unmute. So the FCS Foundation, as Lindsey and I touched upon, we started in 2016. We met at a patient meeting, and it was the first time that Lindsey had met another patient, and Lindsey was in her 20s at the time. And Juliana was just about to be, I want to say 3, and I had sort of just given up that I would ever meet anyone with FCS and that this would just be our life. So when we met, it was really exciting. I think I had a notebook full of questions for Lindsey, and which she very patiently answered. And we just realized that we weren't the only ones, that everyone who was diagnosed with this, even if there was only a handful, deserved the opportunity to connect with one another. And so that's how we decided, with no previous nonprofit experience, to figure out how to start the FCS Foundation and start to find everybody that was out there and to give them an opportunity to connect. Our mission is to establish a global support network to promote advocacy and education for patients and caregivers living with FCS. Next slide. So we're a patient organization. We're 100% volunteer run. Everything that we fundraise or that we bring in goes directly back into programs like this for the organization. We're committed to helping individuals and caregivers affected with FCS. You can find us on livingwithfcs.org. Our website is temporarily down. We're just making some updates to it, but it'll be back up in the next couple of days. You can find us on Facebook at facebook.com/fightfcs. We also have a private Facebook page where patients can talk and share things that are coming up and ask for advice and things like that. We're on Twitter at livingwithfcs, and we're actually also on Instagram. And you can find us on Instagram. I think we're just at livingwithfcs. And on Instagram, we've been sharing some recipes and products and things like that that we've been finding really useful in our diet. Next slide. So I'm going to let Nikki talk about this for a little bit, since she was such a valuable volunteer who helped us make this possible. Lindsey and I had this crazy idea over the summer with all the things that were being canceled, that we should do a virtual 5K. And we had this idea, and then we contacted Nikki, and thank goodness she volunteered to help us do it because she was so instrumental. So I'm going to let her talk a little bit about what we did and the success of it.
Hey everyone, I'm Nikki Charisma, and just really quick, I have I'm not a patient, but my son and my husband are both have both been diagnosed with FCS. I have a 4.5-year-old son, and I won't say the age of my husband because he's sitting right here, but he was diagnosed when similar story, diagnosed when he was born, 3 weeks after he was born, with triglycerides over 20,000. And that's actually also when we found out that my husband, who was in his 30s at that time, also had FCS. So just to give a little background about why I'm here and part of the FCS Foundation. So we did this 5K virtual walk run, which was really successful, and it was really fun. I know that I see some people in here that have participated, and first off, I just want to say thank you for your participation, because it was because of you and your friends and your family that made this event so successful. We had over 175 participants registered in 19 states, which was really cool to see. So many people participating all around the United States. And I want to give a really quick shout out to some of our winners who I also see on the call today. Young in Washington who introduced himself at the beginning, was one of our top 5 winners. Alessandro R. from Italy, Dylan R. from New York, Jess W. from New York, and Alex G. from Massachusetts. They were all won an awesome FCS Yeti water bottle. And then we also had 9 additional winners that won a prize for submitting some pictures during the event. So the most exciting thing that I get to share with everyone today is that we raised approximately $8,000. And that amount would not have been possible if it wasn't for all of our participants and some of our sponsors. And our sponsorships this year for this event were FCS Pharmaceuticals, Arrowhead Pharmaceuticals, Backpack Health, and the National Pancreas Foundation. And we just, again, want to give a huge shout out to them. We are super grateful for your sponsorships, for those of you that are on today, and really hope to partner again in the future. Additionally, we had 16 donations that were just given through our event site. So if you were one of those, or you know somebody that just donated, all of that money was appreciated, and we thank you so much for all of those donations. So as most of you know already on this call, the money that we fundraise really helps the FCS Foundation grow and educate and support people with FCS. And during these kind of, I know this word is overused right now, but unprecedented times, it's even more important for us to not lose that momentum. And so brainstorming ideas and other possibilities that you can, if you have any thoughts or ideas for the FCS Foundation to continue to raise awareness along with continuing to fundraise, it's super important. And so I know these times are challenging, but if you can help, we need you. So if you are available at all to help in any fundraising events, we would love to have your ideas and support. So thank you so much, everybody, for this really largely successful event, and we hope to partner with everybody else in the future. Thanks, you guys.
Next slide. And thank you again, Nikki. I mean, I cannot tell you how meaningful it was to help someone from the community volunteer and help out for us. So, keep that in mind. And definitely check out, National Pancreas Foundation isn't on the call today, but definitely check out their website. They have some really great resources for familial chylomicronemia syndrome. They have the animated pancreas project that you can check out that really breaks down and explains what FCS is, which is a great resource for yourself, for family members, to share with physicians who are new to it. So definitely check them out. One of the other things we've been working on this year is the HEART Act, which is helping experts accelerate rare treatments. And this came about just as Lindsey and I were navigating the drug approval process and working with the FDA, and realizing that the drug approval process was not cut out necessarily for rare diseases. And we felt like we needed to make a difference. So we started by reaching out to our local Congress people who were very supportive. And then that led to us meeting with different Congress men and women on the Hill. And they were like, you know what, you guys aren't the only ones who have been having this problem. And they encouraged us to start the HEART Act. And it really looks at how the FDA interacts with rare disease patient groups, how it gets information, how it assesses whether drugs are safe or not safe, and how it takes into consideration patient input. So we need your help here. We need you to contact your Congress people. We need you to let them know that this is important and that this is an impact and impactful for you. And you can do that by going right. Once our website is up and running, you can go there, or you can go to the haystackproject.org, who we've been working with. Pretty straightforward website, haystackproject.org, act now. There's a form right there you fill out. It identifies who your congressperson is. It'll send your letter directly to them. And really just something as simple as saying, I have a rare disease and I want to have better access to drugs, and I want the FDA to be looking at the drug approval process is really helpful. We have some information that we've posted. We talked with CNN earlier in the year, which was really exciting, and we're so grateful for that kind of press. So please, if you have any questions about it, or you're not sure what to say or how to reach out to anybody, contact us. I realize the process can seem intimidating, but I will tell you, and Lindsey will tell you, as two people who have no nonprofit experience prior to this and no legislative experience prior to this, that you can make it happen. It's very easy and straightforward, and your congresspeople want to hear from their constituents. So you have every right to reach out to them and to talk to them, you know, in your language and in what you understand and why this is important to us. Next slide. Lindsey, did you want to?
Yes, I'm going to talk a little bit about FCS Awareness Day. We just had our third FCS Awareness Day on the 6th. It is always the first Friday in November. And every year we want to do something really big, but then it just seems like that date just creeps up on us. I think many of you saw that there was a join the FCS Diet Day and do the FCS Diet for that day. So next year, the FCS Foundation would really like to do something larger and get our community really involved, because it is a really big deal and it's a great day to raise awareness and reach out to people about this disease. And we really should be capitalizing on it much more than we are. So we're asking the community to send us any ideas. If you have any time that you are willing to volunteer to help us with this, it might seem really early now, but it really isn't. We would love to get started working on something to do next year. So please reach out to us, email, Facebook, Twitter, Instagram, anything with your ideas. We are always listening, and if you don't volunteer too much time, that's fine. We will take any of your help. So it's greatly appreciated, and think about it. Consider helping us out with next year. It'll be a great day. Next slide. All right, I am going to turn it over to Arrowhead Pharmaceuticals if you would like to start your presentation.
Sure, thanks, Lindsey, and thanks for the invitation to present. Can everybody hear me okay? Can you hear me okay? Okay, great. So this is just a few slides, kind of an update to give the punchline of what we're working on at Arrowhead. And you can go to the next slide. Our program is ARO-ApoC3 is a drug designed to inhibit ApoC3, which is a key regulator of triglyceride metabolism. And so I'll provide first just a real brief introduction to Arrowhead and our technology and siRNA as a therapeutic modality. And then we'll touch briefly on ApoC3 as a target to treat hypertriglyceridemia. And then we'll give some summary data from our phase 1/2 clinical study, actually some of which is really kind of hot off the press and is being presented starting yesterday at the virtual American Heart meeting that's ongoing right now. So you're seeing it at the same time everybody else is. Next slide. So ARO-ApoC3 is an siRNA or an RNAi therapeutic, and RNAi stands for RNA interference. And so what exactly is RNAi? Normally, genes or your DNA is transcribed into messenger RNA. And as the name would imply, messenger RNA carries the message, which is then translated into proteins. RNA interference is a natural process that the cells already utilize to inhibit that messenger RNA. And so what we do as an RNA therapeutics company is introduce exogenous siRNA into the cell and take advantage of this RNAi process that the cell already has in a manner such that we can silence specific gene expression. So we inhibit that translation of the message into the protein in a sequence-specific manner. So it's important to recognize that this is a transient effect. This is not a gene therapy. Sometimes we get lumped in with gene therapy, but it really is not gene therapy. It's not gene editing. We don't modify the genome in any way. A dose eventually wears off, although it does have a prolonged effect, usually a few months. You need to repeat dosing to maintain that effect. Next slide. Arrowhead's specific technology for designing these siRNA therapeutics, we call the TRiM platform. And so TRiM stands for Targeted RNAi Molecule. And really what it is a set of rules and algorithms to design these siRNA sequences. We use various stabilization chemistries and linker chemistries, and we use methods to target the siRNA to a specific cell type. And in the case of ARO-ApoC3, this is an siRNA therapeutic that is targeting liver synthesis of the ApoC3 protein. So we only silence or shut down the production of synthesis in the liver. Next slide. We've been at this for a while. We actually have 8 different programs in various stages of clinical trials. You can see ARO-ApoC3 is one of our more advanced drugs, and these are all siRNA therapeutics, most of them targeted at genes in the liver. Next slide. And so why ApoC3? Why go after this with an siRNA gene silencing mechanism of action? And as I alluded to earlier in the presentation, ApoC3 is one of the key nodes of regulating triglyceride levels. It's synthesized mostly in the liver. Also, some ApoC3 comes from the intestines, and it sits on the surface of triglyceride-rich particles like chylomicrons, like VLDL. And as it sits there, it actually inhibits the metabolism of the triglycerides in these particles. So it inhibits the activity of lipoprotein lipase. That's where on the right you see the LPL-dependent mechanism of action. But it also inhibits uptake of triglyceride-rich lipoproteins by the liver. So it actually blocks the uptake by the liver cells of these triglyceride-rich lipoproteins. And so the idea is, with silencing ApoC3 expression by the liver, there will be less of this ApoC3 sitting on the surface of these particles, and that will allow enhanced lipoprotein lipase activity, so peripheral clearance of triglycerides, but also enhanced clearance of these triglyceride-rich lipoproteins by the liver, and that should lead to reductions in triglyceride levels in the blood. Next slide. And so this is the design of our clinical trial. It's kind of a busy slide. I won't go into all the details. The point is that we enrolled healthy volunteers to receive either a single or 2 doses of ARO-ApoC3, and then we evaluated the usual endpoints in a phase 1 clinical study, safety, as well as we looked at levels in the blood of ApoC3 and triglycerides, as well as other lipoproteins. After we completed the healthy volunteer cohorts. We went on to enroll patients with high triglycerides. They had to have triglycerides at screening, fasting triglycerides of greater than 300. And then we had a cohort where we enrolled chylomicronemia patients. And so these were all comers, chylomicronemia, including a couple FCS patients. They had to have triglycerides fasting at baseline of greater than 880 mg per deciliter. And so all of these cohorts have been fully enrolled. Next slide. We shared some of this data. These are data from the healthy volunteer cohorts initially presented at American Heart last year. And this just shows with escalating doses, single doses that were able to reduce ApoC3 levels by about 90+% from baseline in the healthy volunteers. And this translates into reductions from baseline in triglycerides, again, in volunteers of about 40 to 60%. And these healthy volunteers at baseline, their triglycerides were mean values of about 180. So we actually required them to have slightly elevated triglycerides at baseline. Next slide. This is the baseline characteristics of the patient cohort. So we did escalating doses in the high triglyceride patients, and then the 1 chylomicronemia patient cohort at 50 milligrams. And all the patients received 2 doses on days 1 and then again a month later. And you can see the baseline triglycerides here that are highlighted in the red box are fairly high. Even the greater than 300 cohort, many of these individuals had triglycerides in excess of 1,000. These are mean values with the ranges given as well. And then in the chylomicronemia cohort on the far right, the mean values were over 2,000, with some of these patients having triglycerides in the 3,000-4,000 range. And if you go to the next slide, this is what is being presented at AHA. I think the poster was available yesterday, and that should be available on the Arrowhead website. And so on the top, you have the high triglyceride groups. These are the greater than 300 patients. And as we dose escalated, you can see some dose response. Really, everybody responds, even at 10 milligrams, reasonably well, with nadir reductions in ApoC3 ranging from 80% to upwards of 99%. And then on the right, you can see the corresponding reductions versus placebo in triglycerides, with the triglyceride reductions ranging from 74 to 87%. On the bottom, these are the chylomicronemia patients. So these were the patients that had to have triglycerides greater than 880 mg per deciliter at baseline, and everybody received 50 milligrams. There was no placebo group here. We wanted everyone to have the opportunity in this exploratory cohort to receive drug. And the reductions in ApoC3 at nadir were mean reductions of 96%, with the corresponding triglyceride reductions of 88%. And again, this is with doses on days 1 and 29. And what you can probably see from this plot is the duration of effect, that the duration of reduction really lasts out through week 16 after that second dose. We continued to follow these individuals actually in all of these various cohorts past week 16 to get an idea of return towards baseline. And we start to see a little bit of loss of control after week 16. It depends on the individual. Suffice it to say that I think the plan is, at least for our next stage of clinical trials, that we will dose quarterly. There may be the opportunity for dosing every 6 months. We can go to the next slide. And this gives the summary safety data in the patient cohorts. You can see at the top, we do see the occasional injection site reaction, and we take pictures of all of these. And typically what these look like is an area at the injection site about the size of a quarter that is either red or bruised and tends to go away over about within the 48 hours around dosing. So we see that. We see the occasional increase in ALT, a measure of liver function, and that is typically after the triglycerides reach their nadir, and usually for about a single time point in the study, with those ALT values returning towards baseline. And everything else we see here on this AE table or adverse effect table, fairly standard in phase 1 clinical trials: headaches, upper respiratory infections, all fairly common in phase 1 clinical studies. So next slide. In conclusion, ARO-APOC3, one of our lead siRNA therapeutics, again designed to silence liver production of the APOC3 mRNA, so far has been demonstrated in healthy volunteers as well as in patients with high triglycerides and chylomicronemia to have a safety profile that we think supports later stage clinical development and has shown significant and durable reductions in triglycerides. And as I mentioned previously, given what we've seen with the duration of effect, we're looking at probably quarterly or maybe even less frequent dose administrations. And we're planning to initiate global clinical studies, phase 2b clinical trials in the US as well as in Europe, likely other countries, Canada as well, in patients with, and these studies will include patients with severe hypertriglyceridemia as well as chylomicronemia. And when I say chylomicronemia, we will enroll both FCS and multifactorial chylomicronemia patients. And so that's all I have today, and happy to address any questions now or throughout the rest of the event today or during the Q&A.
Thank you so much, James. That was really neat to see all the data and learn more about your upcoming clinical trials and drug. Thank you.
Sure, my pleasure.
I'm going to turn it over to Ionis now.
I'm just going to add real quick.
Oh, sorry.
If anyone has any questions, they can pop those into the chat. And even if we don't get to it right away, when we're done, we'll go through the chat and see if there are any questions that people have commented on. That's all. Sorry, Lindsay.
Take it away, Ionis. Thank you.
Thanks, Lindsay. Can you hear me okay? You're good. Good morning, and thank you so much to the FCS Foundation for really inviting us to be part of your conference today. I have to stop and just commend you on what you've accomplished since 2016. It's crazy. It's inspiring. You've created an entire community, and you guys should be so proud of what you've accomplished so far. So just thank you from the bottom of our hearts for letting us be a part of that today. And it's super nice to see all the familiar faces. I have to say, I think I met Lindsay in 2012. And she was still in college, and so to see you guys now and just what you've accomplished, it's very warming to see. So, and thank you to everybody else for really taking part of your Saturday to listen in to this. So my name is Christina Boyer, and I'm the Vice President of Patient-Centric Drug Development. I've been with Ionis for over 28 years, so some of you might recognize me. I had a different last name a long time ago, so that could be what it is, but it's the same old Christina. And Ionis has really been around for over 30 years. We have several marketed rare disease products, including Spinraza, Tegsedi, Waylivra in Europe. And similar to what you heard with Arrowhead, all of our drugs do target RNA. We have a pipeline of over 40 drugs in development and a real intense focus on cardiovascular and rare diseases. And that's really, we stick to where our expertise lies. And one of the things you might have recently heard in the news is that Ionis really took an important step forward in our evolution, and we reacquired Axia. And as you know, Axia was already majority owned by Ionis, but this transaction really supports our future, and it supports our future transition to commercialization. So coming together was a really important piece to that strategy. And we feel really strongly that as one company, we are stronger and we will be more efficient moving forward. And it really puts us in a great position to collectively use our abilities and really strive for an even greater success together. So this is something that we're very, very excited about. And to have that commercial expertise in hand for Ionis through Axia is really important and a critical component to our future. I think I just want to touch on another hot topic that is probably on your mind. And it's really the status of Waylivra. And we are hard at work, just so you know, preparing to refile that application for marketing authorization in the US. So we're looking to do that in 2021, next year, which is unfortunately, scarily, just a couple months away or a month away. So we're very excited and looking forward to that. But what I think is really important is that we're doubling down on ApoC3, right? We recently announced positive phase 2 data of Axia ApoC3 LICA, and those results were just presented at the European Society of Cardiology, the annual meeting there. And so what we're doing is really rapidly advancing that ApoC3 LICA molecule into phase 3. And I'll talk about that for just a bit. But I think an important message that I really want to convey is that it's our commitment, right? Our commitment to ApoC3 is really evident in even in the consistency of our team. We've been focusing on the cardiovascular space for 20 years now, and ApoC3 itself really started with us in June of 2000. And that's when the original cardiovascular group at Ionis was formed. And, there were 3 people involved. It was led by Dr. Roseanne Crook. Mark Graham did a lot of the lead drug identification, and myself as pulling in the animal pharmacology side of the program. And so, I remember the first time we had a lipid expert explain, what FCS really was and what the impact of having blood that's so filled with triglycerides in your blood that you could actually see it without even analyzing it. And so that really left an impression on not just me, but as us as a whole. And so, there's over the years, what we've learned is, there's that triglyceride component, but FCS is so much more than just the lipids in your blood. It actually affects every aspect of your life. And that's really why we're focused on the future for FCS patients. Next slide. So as I was saying, our commitment really began a long time ago. Many of the people that were on the Ionis team still are on the Ionis team. And I just thought I'd put a few people on this slide just to highlight some of the individuals. Dr. Sam Samikas, he's a leading cardiologist, lipid expert. He is running our cardiovascular franchise, and he's really been, a driver for this program for many years since we first met. Before he was even part of the Ionis team. We're lucky to have Vicki Alexander leading the development for ApoC3. She ran the original ApoC3 studies and is leading the future studies for ApoC3. We have Alex Glover, who has been developing patient support programs that you will hear about that we're very proud of. And we're doing this because we want to create a better future for FCS patients. We don't skip me. Dr. Lisa Johnson Pratt And, she's a physician that is leading new product strategy and leading the future of the ApoC3 franchise, which is key, right? It's not just the drugs that we made yesterday or that we're making today. It's what does the future of our portfolio look like, and how do we take care of patients moving forward, and making sure that we're creating, and fulfilling that unmet need. And then now we also have Lori Gorski, who I'm sure you all know and love, has been leading a lot of the advocacy efforts for several years now. Ken Bush is also part of the advocacy team, and Gail Harton. So I'm sure as we progress, I'm sure you'll learn to get to know everybody, and we'll all hear. We will can't talk. We'll all be here to support you and work with you going forward. And I think with that, I'll pause for a minute and go to the next slide, and Lori can take it for a minute.
Sure. Thanks, Christina. Hi, everyone. Lindsey already touched upon it, but I just wanted to share some of our activities for our third ever FCS Awareness Day, which of course it was the last Friday or the first Friday of the month of November. So we were very active both on the FCS side and on the Ionis side. And you'll see from my Zoom background that this is something that we created for FCS Awareness Day, but we love it so much that we're continuing to use it. So if anybody else wants this background, we're happy to make it available to you. We did a pretty comprehensive social media program, and as Lindsey said, we connected it a lot to the diet and the challenge around the diet. So we invited others to join the diet challenge with us because we invited employees as well to participate in the diet. And we also used the social media platform to celebrate some of the real leaders and special people who are in the FCS community. And what was great about that is we saw a lot of sharing and liking from our partners at the National Pancreas Foundation and some of the other associations out there, which was great. November is also Pancreatic Disease Awareness Month in the United States, so it's nice to have that connection with these other foundations. If you see on the bottom right, you'll see the cover of Rare Revolution magazine in Europe, where Reliever is approved. We were able to secure an entire edition of Rare Revolution, and we featured a lot of patient stories, but also shared a lot of just fundamental content about what FCS is, how to recognize it, and what it looks like to live with such a disease. And I saw that the FCS Foundation shared some of that content from Rare Revolution. So if you haven't seen it already, I really do encourage you to check it out. And like Lindsey said, there's going to be another FCS Awareness Day just around the corner, and I encourage you all to get involved. The more participation we have in the United States and globally, the stronger our voice becomes. Next slide. So I've talked about FCSFocus.com on the last meeting that we had, but I really want to continue to encourage people to check it out and visit. Through FCSFocus.com, we share a lot of content and resources about living with FCS, materials that you can share with your doctor, materials to share with your community, recipes. Mary's been involved with a lot of this content, and she's featured on this website. And then, of course, 2020 was a pretty crazy year, and it was hard on all of us, but we understand that it was particularly hard on the FCS community. We heard from a lot of patients who really struggled with isolation, with fear of visiting their doctor, with just struggling to find fundamental food, the basics in the supermarket. And so we have created a lot of content and resources that are available to you to help sort of navigate this really weird time. And you can sign up for emails for that information as well. So also, as we look ahead to better times in 2021, we have a lot of new resources that we're going to be sharing with you very soon. The first will be new content and new information about the value of genetic screening. material that can help inform you, but also that you can share with your healthcare provider as well. So keep a lookout for that. And also in the works is a new FCS website that's going to be dedicated to physicians and healthcare professionals. And I believe it would be a really great resource for you to direct others to, other healthcare professionals, if you want to help educate about how you live day to day with your disease. So more to come. Here's to better and brighter days ahead for all of us. And thank you for hanging with us through this time. That's it. Next slide.
Thank you, Lori. And really, I just wanted to spend the last slide just talking about the balance study. The purpose of the balance study is really to determine the potential new treatment Axia ApoC3 LICA is safe and effective in really breaking down dietary fat and triglycerides and helping slow progression of disease while also improving the quality of life for patients with FCS. So that is our up and coming phase 3 study that's starting. It will be a multi-center randomized double-blinded controlled study. Our drug is, the drug will be delivered, it's a monthly subcutaneous administration. And to pre-qualify for balance, you have to be at least 18 years of age, have a medical diagnosis of FCS, preferred history of pancreatitis, and willing to maintain an FCS diet of 20 grams or less per day. There's additional requirements that and testing that are needed, but what I would like to say, this is a decision for you and your physician to make. And so what we would like to do is just provide you with the information and the materials for you to take to your physician, and so that you can decide, what is the best path for you going forward. This is the next step past volanesorsen. It will be including patients that historically were on volanesorsen. And I think that's important that, this is something that are continuing to grow this franchise. And so I think that's exciting. We'll be announcing when recruitment starts shortly, and we'll put out a community statement to really highlight that. Next slide. And again, I want to thank you. Thank you for letting us participate in today's conference. And if there's any questions, or if you're ever interested in sharing your story, please reach out to us. As you can see, there's an entire team of us, and we would love to learn more about you, your experience in living with FCS, so that we can better understand that and implement that in our program going forward. So you could email us at patients@ionisph.com. And thank you for your time and for letting us participate today.
Thank you so much, Ionis. Thank you, Lori and Christina. I'm really excited about all of that information, and I know that our community is as well. Same thing, if you guys have questions, feel free to put it in the chat, or we can address them at the end of the meeting as well. And I am going to turn it over to Backpack Health. Next slide.
Thank you. Can you guys hear me okay?
Yes.
Awesome, thank you. Hi everyone, my name is Lauren May, and I'm the Senior Director of Compliance and Subscriber Services at Backpack Health. It's such a pleasure to be here with the FCS community today, and I really appreciate you having me here. So the FCS Foundation has teamed up with Backpack to bring a customized health management experience to the FCS community. And the foundation's been doing a lot of work up to this point to make the tool available to you today. So everything that I'm going to talk about today, you guys can join and be a part of. I'm going to spend some time talking about what Backpack is, and then we'll get a little bit more into the details of working with the FCS Foundation. Next slide, please. So what is Backpack Health? We are an app that you can use on your Android or Apple device, and also on the web. And we allow you to securely store, manage, and share all of your health information, all of your family's health information in one single place. So I realize I am preaching to the choir when I'm saying that managing your health info can be really complicated. Maybe you or your loved ones are seeing multiple physicians in different health systems. You have to log into multiple patient portals to get this information from here and this information from here. Maybe you've got a Google Drive folder that has scanned versions of your visit summaries and your test results and things like that. Maybe you're old school and everything's on paper and it's in a binder or a folder or filing cabinets or things like that. That's totally cool too. It's a lot to keep track of, and our hope at Backpack is that we can help you do all of that tracking in one place on your phone or on your laptop, and in a place that you can have with you all the time. So all of that important health information is always with you and available. Backpack gives you data freedom. So you decide what info makes it into your backpack and what doesn't. And you always have control of what's in your backpack and with whom you're sharing that information. We'll talk about sharing in a little bit. If you happen to be caring for someone else, your child, an elderly parent, you can create a profile for them and manage their health in the same place that you're managing your own health. You're not having to log out of one account and log back into another. It's all done within one single application. You have just a couple profiles that you're working with there. And it doesn't matter what conditions you or your loved ones have. If someone has FCS and someone doesn't, you can manage anyone's health information with Backpack. We're available for everyone. We're multilingual. We're currently available in 6 languages: English, Spanish, French, German, Portuguese, and Italian. And that means that you can use the app in your native language if it's one of those, or you have some freedom when you're traveling abroad that you could use the app or switch your health information to one of those languages if you're in a country where that language is primarily spoken. And finally, Backpack is free for everyone to use. So that's one of the questions that we always get. How much is it? It's free. Next slide, please. So at Backpack, your privacy and security are very important to us. We can't function if we're not doing a good job on both of those things. So as you're setting up your Backpack and you're entering health info into the app, we're telling you every step of the way why we're asking for the information that we are. We use easy to understand language within the app. You can also check out all of the same information in our privacy policy. We spell out the details there. It's probably a little bit more legalese because privacy policies tend to be that way. But we're very transparent in why we're asking for the information that we are as you're using the app. All the info that you enter into Backpack is encrypted. We hear that word a lot now. It means that if somehow someone were to gain access to our secure systems, which is highly unlikely, the info wouldn't make sense to them. It's coded in a way that it just wouldn't make sense. And then finally, to help protect your account, like we've got all the tech things we're doing on our side with our engineers. We also offer you the ability to enable two-factor authentication, or 2FA. So if you've ever used a banking app, you're probably familiar with 2FA. We ask for your cell phone number. We only use it for this purpose. And when you log into your Backpack account, we text you a code to make sure that you're the one actually attempting to log into your account. Next slide, please. So there are 2 main ways to get health info into your Backpack. You can enter details manually, and we have a nice, easy to use setup for doing that. So, you want to enter your conditions or your symptoms or your medications or any number of things. You can do that. You can also link your Backpack profile directly to your patient portals and import info from your patient portal into your Backpack account. The nice part about that is that you can look at what is coming over from your patient portal and decide, oh, you know what, that's not actually relevant. My doctor prescribed that medication, but I ended up not taking it. I'm not putting that into my Backpack. You have control over that information, just like you have control over all of the information that you're putting into Backpack. This EHR or electronic health record integration is a really nice way to get a lot of information into your Backpack if you have a long, complicated health history, which a lot of us do. Finally, with regard to the EHR data connection, we don't connect to absolutely every patient portal in the country, but we are working there. We have a third-party organization that we work with who is constantly making new connections. So If you attempt to make a connection to your patient portal and it isn't currently supported, let us know, and I'll tell you how to do that later on. We will do everything that we can to help facilitate that connection as soon as possible. Next slide, please. Thank you. In the Backpack app, we have something called share cards, and they allow you to share important health info with those who may need it. So by default, every Backpack Health user gets 2 share cards. There's an emergency share card, and there's a health history share card. But you can also create as many custom share cards as you want on top of those 2. So why would you want to create custom share cards? Let's say that you want to share real-time health information with a new healthcare provider, with the school nurse, with a babysitter. We're not doing much travel these days, but if you were traveling and had a travel buddy and you wanted them to have access to some of your medical information, those are reasons that you might want to set up a custom share card. You can easily create share cards for these individuals and then include the info that's important for them to know specifically. So for example, a babysitter share card lets you share info that a sitter might need to best care for your child for a few hours while you're away from home. They probably don't need to know about a broken bone 7 years ago, but the things that are relevant right now, this is a current condition, these are current medications, things like that. You can customize that for that babysitter.
Lauren,
you can change. Oh, yes.
Can I interrupt you for a second? I'm sorry. As a parent, one of the things that I think of when you share this is, the question I always get from babysitters is, can she eat this, yes or no? So to be able, that's something you could do on a share card, is put all the foods you can eat, all the foods you can't eat, share that with the babysitter. You could share that, if someone's cooking a meal and they want to know what you can have and can't have, you can have your yeses and then your no's to your oils and your butters and all of that stuff. So I just wanted to, while I was thinking of it, I see that as being a really relevant way to utilize the share card.
Absolutely. Thank you so much for pointing that out, Melissa. And the great thing about a share card and sharing information like that, you can remove someone's access at any time. So let's say you have a regular sitter and he or she goes off to college. They don't need access to your child's health information anymore because they're not a regular part of your lives. And you can turn off that access and make it so they no longer have or that health information is no longer available to them. Next slide, please. So we talked about the custom share cards. Probably the share card that gets the most excitement out of our Backpack users overall is our emergency share card. We consider this to in a lot of cases, be the most important one that we offer. So an emergency share card lets you put the critical details about your health, including emergency contacts, on your emergency share card. So every emergency share card has a unique URL, tripping over words is contagious today. You can add that unique URL to a medical bracelet, to the lock screen on your phone. You can have it put on the fridge if that's a logical place that you think someone might look. And the beauty of this is that first responders can use their own device to view a live read-only version of this health information. So it's a URL. They can't make any changes to that health information there. They can just see the information that you want them to have in case of an emergency, if you're unable to speak for yourself, or in the case of your child, if you're not there in the moment and something happens. So we do have examples of people who have used this and have said that it has really helped them in a moment when they were unable to speak for themselves. Next slide, please. Living with FCS on Backpack Health. So the FCS Foundation has partnered with Backpack to provide a customized experience for FCS patients and caregivers. So this means that you can use Backpack to manage, track, and share all of your health information, just as I talked about. And you can also use it to access really important resources that the FCS Foundation has identified. You can also add information about FCS to your share cards. Any share card you create, you can add information. And that's info also that the FCS Foundation has provided. So, you might want to put on your share card this FCS information so that someone who may not know anything at all about FCS is getting a high level picture of what it is that you're dealing with Whether it's a new provider, it's that emergency share card, whatever, you can include that information there. Individuals who join the group can share their health information, any health information that they choose, with the FCS Foundation to help the foundation learn more about individuals in the community. There is no directly identifying information shared there whatsoever. So there isn't a way for the foundation to trace back who the information belongs to. Next slide, please. So if you're interested in checking out Backpack Health or joining the Living with FCS group on Backpack, you'll first need to either download the app on your Apple or Android device or visit our homepage at www.backpackhealth.com. Once you're logged in, and we can go back and look at these slides, go to groups in our main menu and you'll see Living with FCS is one of the groups that's listed there. You can also use the link on the screen here to get started. That will take you right to the FCS group on Backpack Health and walk you through the steps of setting up your account. So 2 different ways there. Next slide, please. At Backpack, we are really interested in making the app the best it can be for our users. So if you have questions or feedback, you can email us anytime at help@backpackhealth.com. You can also chat with us from within the app. There's a little chat bubble, whether you're on the web or on your smartphone, that you can use to reach out. The cool thing about our chat feature is we actually have 2 real people that answer all of our chats, and they're awesome. People are shocked that there's an actual live person answering their questions and helping them out. We cover a lot of hours during Monday through Friday, and if something urgent were to come up over the weekend, we do our best to resolve any issues then as well. You can follow us on social media to keep up with our new features and engagements. And finally, we have a really nice help center that's full of useful how-tos. There are videos that walk you through how to do things, tips, tricks, all of that. Anything you're trying to do on Backpack that doesn't seem intuitive right away, which I hope there aren't a lot of those things, we do have a help center that walks you through all of those bits. And I've included the link to the help center on the slides here. And we have a number of articles, but these are 3 that I highlighted as being particularly of interest. Next slide, please. I am a Backpack user. I hope you love using Backpack as much as I do. And I really appreciate you having me here today. I'm thrilled to be here. I will turn things back over.
Thank you so much, Lauren. We are so excited about Backpack Health because we get so many questions about having emergency room letters and having things like that available. And we think that this is a really good place to put that. And we can help develop the content that goes on there, but you guys also have ownership over whatever you want to put in there as well. So you can make that go in and check it out, play around with it. And if you have questions or if you feel like there's a hurdle and you can't figure out how to do something that Lauren explained, we can revisit it. The Backpack team has been so great with us. So I'm sure that we can schedule another conversation about how to use it, but definitely download the app or get online, check it out, play around with it, and then let us know what you think and what we can do and work on that. We are going to take a quick 5-minute break just to stretch our legs, and for our friends on the West Coast, maybe get another cup of coffee, and then we'll meet back in 5 minutes. So that will be like 12:12 New York time.
And if you could just leave everything exactly as it is, maybe switch your camera off. When you return, turn your camera back on, and then we'll know you're back in our room. So have a good break. Mary,
Okay.
are you ready?
Yeah, I'm ready.
Okay.
Great. So we're going to have Mary Felando, who is a registered dietitian and nutritionist and clinical lipid specialist. She's also on our medical advisory board, and she's going to talk to us about having some healthy holidays, FCS style. We know the holidays can be a cause of some stress and anxiety for people. So we always look forward to what she has to share with us. Thank you, Mary.
Thanks, Melissa, and thanks, everyone. Good to be here this morning. And I guess we are going to be having a little bit of a different kind of holiday this year. And I'm trying to, okay, I'm controlling. Let me make sure I can change my slides. Yeah. Yeah, so a little bit different kind of holiday this year, and one where we may not have as many people around us. So in a way, it's a great time for you to test recipes, and you're not testing them on, 45 different friends and relatives. Maybe you're just going to be having 4 or 6 or 8. So people are more forgiving if things don't turn out. So it's a good time to try some new things this year. And what I'm going to talk about today is just to review the general recommendations. Some of you were on calls before and we've gone over these. So want to just briefly do that and take a look at the 2020 nutrition label. A little bit more about MCT oil. I don't know how many people use that, but we'll give you some information about that. Thanksgiving feast, how you can quickly change the high fat items into low fat, and strategies to minimize the overwhelm, and how to modify your own recipes. We did not get an FCS patient recipe featured, so we will just be using one of mine. And then it's a good time to create new holiday traditions. Just remember that everything we talk about today are general recommendations, and your healthcare providers know you better than anyone. So test anything with them. Ask them if this is something that works for your particular case. So food plan wise, we have the recommendations that were put forth by Williams et al. In a paper from 2018 in the Journal of Lipidology. And this is an overview of that, but we've given you the paper in case you are seeing a new healthcare provider. You can give that information to them so that they can see what kind of eating styles recommended. And you know better than I do that, up to 20 grams of fat a day, include a source of linoleic and alpha linolenic acid, which could be something like your chia seeds or milled flax, because those fatty acids are not made in your body, but need to be provided. Select your lean proteins that you're familiar with. Enjoy generous portions of vegetables. I think if there was one thing we could all do for a New Year's resolution, is just to fill half our plate with vegetables, or think about some different vegetables that we might enjoy and make them main dishes rather than side dishes. Choose more whole grains like oatmeal, whole wheat bread and pasta, brown rice, and even looking towards some of the newer whole grains like farro and quinoa, and avoiding the refined grains like white bread, white crackers, and white rice. You have lots of things to use as far as the fat-free dairy products go: milk, yogurt, cottage cheese, sour cream, and cheese. Minimize soda and added sugars. And I think this will be a little bit easier in 2021 because a lot of the processors are giving us newer products that are made without added sugars. Eliminate alcohol and balance your food and fat intake throughout the day. Don't save it all for dinner or for that special evening meal. Try to balance things out, and also balance the calories and activity to maintain a healthy weight. Some people have to try to even eat more calories to maintain a better weight because they get a little too thin with a lot of the recommendations. And then drink plenty of water to stay hydrated, because being hydrated can decrease your chances of having pancreatitis. So this was something we used on the FCS Focus webinar for our holiday last year or the year before, but it's, just a kind of way to put that all together. If you're a visual person, this is what a good FCS plate should look like. And then, in 2020, we got our new nutrition label, which was helpful. And the things that were the same is, well, a little bit different, the serving size, because serving sizes are more realistic. For instance, ice cream used to be a half a cup, but who was really eating a half a cup of ice cream? So they look at how people were eating and they said, you know what, it's more realistic to think of it as 2/3 of a cup. So everything is a little bit different serving sizes. Next, of interest is the grams of fat. So be sure to, look at that, that. But the new for 2020 was really these grams of added sugar, so that you can look at products like barbecue sauce and ketchup and some of the things and sort of get an idea of how much added sugar is in a product, where before it was hidden because this information wasn't there. And because the information's there now, they know that you're looking, so they are looking to provide products. I was surprised when I went to the store and I could see no added sugar chocolate syrup and no added sugar barbecue sauce and different things that I hadn't seen before. So hopefully we'll be seeing more products like that in the future. What manufacturers are also looking at is how they can use these sugar substitutes or products that are sweet that don't provide any calories. So this is kind of a 101 thing. And I really wasn't as up on things because there's so many new things on the market. I could do an hour lecture just on sugar substitutes. But quickly, and again, if you're going to use a sugar substitute, talk to your physician to see what's right for you. There are different recommendations for different people. So we have the artificial sweeteners that you're familiar with, the pink, the blue, and the yellow. And I look toward, it's called Center for Science and the Public Interest, and they're a group that kind of looks as watchdog on the FDA and the different additives and kind of give us an idea if they think these are healthy or not. And they really have given all of these things a no-go. So that's why I think manufacturers like Splenda are now having Splenda with stevia, because that's a more natural sweetener that's been given more of an okay than these products to the left. So next we'll look at some non-artificial sugar sweeteners, and the ones like sorbitol and mannitol and erythritol. They have been around, and particularly erythritol I'm seeing a lot more now. It was approved in 2001. It is considered a very safe food additive at this time, and it's different from sorbitol and mannitol because they are metabolized and fermented in the GI tract and can give you gas or diarrhea. So, I went the wrong way. So that is something that, of course, you already have issues with your stomach. You would not want to be using these products. But erythritol, it is absorbed directly into the bloodstream and excreted unchanged, so it's not fermented by bacteria. It's not as sweet as sugar, but it adds bulk and mouthfeel. So a lot of the new sweeteners, as you see the stevia and the monk fruit, these sweeteners are being combined with erythritol to give it a bulking agent, because stevia over in the next part is 300 times sweeter than sugar, and monk fruit extract is 200 times sweeter. So it's just like these things are so sweet that they would almost not even fill up the sugar packet. So they have to add the bulking agent in of the erythritol. Of these, stevia has been given a green light to say that at this time they feel that it is considered very safe. But know that it's not totally natural, because in the beginning in Paraguay, they used plant leaves to sweeten things. Now, of course, they are using some processing to get this into the sweetness. The same with the monk fruit. It was a melon in Southeast Asia, and it has been around for a while, but now it's getting into our food, and it is approved by FDA, but it still maybe needs more testing. But what was interesting as far as the monk fruit goes is that when I did use this for my pumpkin pie, it was absolutely delicious. You measure it just like sugar. And in fact, I had to decrease the sugar when I used the monk fruit. It was the Libby's pumpkin pie was 3/4 cup. I only used 2/3 of a cup because the 3/4 cup was just too sweet. And I like sweet things, so it was just way too sweet. So it's an interesting thing to try with your baking products. And then there are blends like Truvia and I think Splenda, they have blends where they blend in some sugar with some of the sugar sweeteners. So they still provide added sugars, but less than regular sugar would, and you use the amounts that are listed. So it's just kind of, we have some new things to try maybe with some of your products and your recipes. Okay, what about MCT oil? So this has been around for a long time, and I noticed that people with FCS in other countries use MCT oil a lot more than we do here in the US. MCT is medium chain triglycerides, and there are only two safe ones, caprylic and capric acid. So if you were looking at a label, you want to be sure those are the only two. This oil is safe for people with FCS because it's absorbed directly into the portal circulation and does not require lipoprotein lipase. Don't confuse it with coconut oil, though, because coconut oil has MCTs plus long chain fatty acids. So when you go to health food stores or even your pharmacy section, they'll say MCT oil, coconut oil, and they use them interchangeably. But that is not okay for someone with FCS. It's recommended that we use a pharmaceutical grade of MCT oil. And just know that if you just go on Amazon, it is not regulated for content. The FDA does not look at what's in that bottle. As long as it doesn't do any harm, it is considered safe. So they could say it has only MCTs when maybe it doesn't. A healthcare professional can tell you about it and maybe write a letter to help you with reimbursement, because 6 bottles of this, and it's quart-sized bottles from a company that would be considered pharmaceutical grade, 6 bottles are $399. So that's a lot of money. And that's the pharmaceutical grade. And note that it is not a source of essential fatty acids. So some people think that it is, and they would take it instead of maybe having a little bit of flax meal or yeah. So how do you use it if you're deciding to try it? Then introduce it gradually, because if you take too much of it all at one time, it can cause pain, nausea, and vomiting. Start with a teaspoon a meal per day, move up, and the next couple days add another teaspoon. Work with your dietitian to determine what's the right amount for you. And it can be added to smoothies. It can be used as salad dressings. You can use it even to brush on a fat-free pizza crust. And to keep foods from sticking to pans or grills, but it is not used for like wok frying or very high heat, because it has a low smoke point and burns easily and gets a bitter taste. So use at low to medium temperatures. And for baking, it's recommended that you stay at 325, although the company that makes this did have some recipes for 350. So I think, we could try it, but try to keep the oven at 325 or less. Okay, I happen to be getting my flu shot at CVS Pharmacy, and I saw right next to me was, a lot of different products, and this MCT oil was there. So in big letters, it says MCT oil, and then it's derived from coconut oil, which most of them are. But is this something that you would buy? So I'm going to, let you look at this label. A tablespoon has 130 calories and 14 grams of fat. But if you have FCS, you really wouldn't count. If this was all MCT oil, you do not need to count it as grams of fat, because it is not the long chain fats that you guys are have trouble with. So let's take a look. And, we want to look at the medium chain triglycerides. And what do you think about that? it has one medium chain triglyceride that's really not considered a medium chain triglyceride for FCS. It has lauric acid in it. So this would not be a good product. If you wanted to take a photo of something that you see and ask your own dietitian or physician, is this something you think I can try? But really the best thing is go to something like the Nestle Nutrition Store and buy an MCT oil that is 100% pharmaceutical grade. Okay, let's take a look at our own recipes and think about how we would modify them. So target a favorite recipe or two beginning a few weeks ahead of the holiday and practice with it. Have it as something that you're going to have for your regular meal, but see how everybody likes it. So first focus on recipes that are no added fats or oils. Those are really easy ones that you can just omit. Like if you look at a stuffing recipe and it has a stick of butter in it, if you use no butter and use a little extra broth, it's still going to be moist and would work pretty well. If it's in other recipes like loaf, cake, or muffins, you could replace the oil 1-to-1 with unsweetened applesauce or non-fat yogurt. You can also do it with pureed dates or pureed prunes or other things that absorb water from the atmosphere, can make a loaf cake or a muffin very soft and moist. You just don't want it to be dry. You can also replace the oil for oil and salad dressing. So you can use your MCT oil in a salad dressing recipe, or for a recipe that uses low to medium heat. For instance, if I was making a stuffing, I could saute my celery and onions in MCT oil over low to medium heat and use that for the rest of my stuffing. So I'm going to have a little bit more fat, but it will be fat that an FCS person could metabolize easily. Next, you're going to look, okay, so that was the fats and oils. Then you're going to look to see what is it? Is it wheat flour? Is it white flour? Wheat flour, white flour, pretty much the same thing unless it says 100% whole wheat. So your next goal is to make all the grains whole and see how that can be. I like to use, instead of whole wheat flour, I use the white whole wheat flour because it's not a strong flavor and it works perfectly. And it's, as far as you're concerned, it is a whole wheat. So that's a good product if you don't have a bag of that in your pantry. Go get some and try that the next time you make your muffins or your loaf cake or another baked item. You can also try, of course, brown rice and make pilaf with farro or quinoa or whole wheat couscous. And also whole wheat breadcrumbs are really good for, your oven fried products. I love to just take, even a breast of turkey and then cover it in fat-free ranch dressing and then cover it in whole wheat breadcrumbs or whole wheat panko and bake it in the oven. And that tastes really good. Stretch your starch recipes like stuffing by and then eliminate added sugars like sugar, syrup, molasses, corn syrup, even honey and agave are not okay for someone with FCS. But try some of the available sugar substitutes or sugar-free versions of syrup and jam. So try the monk fruit in a baked recipe and see how that turns out for you. So Thanksgiving is kind of an easy meal to make fat-free and healthy because it starts with the big bird himself. And, that's already a great, 1 gram fat for 3 ounces of animal protein is a great deal. So be sure to buy the unbasted turkey and then baste it with fat-free broth. And before eating, remove the skin. You are allowed to keep the skin on when you're cooking it because they don't think that the skin actually infiltrates the flesh that much, but does keep it moist. But to be on the safe side, if you prefer, then take the skin off of one side for the person with FCS. and enjoy that. For gravy, I never made gravy myself at home, but there are the fat separator gravies. But we usually will get like the commercial fat-free gravy by Heinz or one of those products, and use that for people that like to have gravy. For your dressing, just cut up whole wheat bread. I do that all the time, and it works great because with the turkey breast so good, especially that half like Jenny-O turkey breast that we use and put that in the crock pot. We'll have Thanksgiving dinner several times, even in a month, because that turkey is so good. But then you want to have a little stuffing, and just cut up your whole wheat bread and use the fat-free broth, and add lots of onion and celery and all your regular ingredients for your dressing. But you can either saute in the MCT oil and bake at 325, or you would just use your broth to saute and then bake at whatever temperature you want to for your dressing. Your mashed potatoes, you can use like Molly McButter butter sprinkles and skim milk or fat-free broth. Some people put fat-free sour cream in to give it a little bit more creaminess. So those are good suggestions. Green beans don't need to be in a big greasy casserole, with all kinds of crunchy onions on top. You can either just have beautiful fresh steamed green beans with herbs, or make your casserole with healthy request cream of mushroom soup. And even if you need some crunchies, one nut that is crunchy that does not have any fat is a uh, let's see, Chinese, not a chestnut, but though chestnuts do not have any fat either. But you can use not bamboo shoots. What's the word I'm thinking of? But I know you guys are all muted. But anyway, you can use those. I'll think of it in a little bit. For cranberry sauce, go ahead and cook your fresh cranberries yourself with a stevia-based sugar substitute for a little sweetness, or put some orange rind in, and try doing your own cranberries. Yams, you can use a touch of the sugar-free. I saw so many sugar-free maple syrups now. And then a little cinnamon. Just baked yams taste good. Yeah, Sarah's saying, is it a water chestnut? Yeah, it is a water chestnut. Sorry. Yes. Thank you, Sarah. Water chestnuts in the can, chopped up and put into your green bean casserole. Really good. So sorry about that. Okay, back to salads. Fat-free mayonnaise is still around, and pretty easy to find. By Kraft is the one that I see, but you could use any of your non-fat yogurt or Greek yogurts, or your fat-free dressings to make salads. Sugar-free gelatin is a great start of any of the gelatin desserts that someone would want to have, and put in unsweetened pineapple, fresh cranberries, and celery, and make your own kind of gelatin desserts. I made that fabulous pumpkin pie crustless, which was really good. And if you have kids, pumpkin is a great vegetable, and it's full of vitamin A and beta carotene. So there's no reason that, this could be a wonderful breakfast even, because all it was made with is evaporated skim milk and egg whites. And then I use the monk fruit and put it into little custard cups. And if you want to, you can crumble up some low-fat graham cracker on top if somebody wants that little crust feel. For fruit-based desserts, you can make cobblers with apples, oats, and stevia-based sugar sub, cinnamon. You can also bake apples and pears, and those are good. And then offer spa water and mocktails, diet tonic, and soda water with lime are good choices. Next, this was a recipe that I've made probably for about 25 years, if you can believe it. Not this one, not the original recipe, because I don't make anything with butter and all that stuff. Anybody can make that taste good. The challenge is when you're making it healthy. And if it still tastes good, that is really the best part. So I transformed this recipe into one that used whole wheat flour. And instead of the butter or margarine, I used a cup of pinto beans, which I wash and drain and just put into the food processor with everything else. I used the applesauce instead of I put that in as a little bit of extra to make sure that it was going to be moist enough. And then vanilla extract and your spices. If you want to put raisins in, go ahead. If you want to make a half a pan with nuts and maybe half a pan without nuts, if you think people like the nuts and the FCS people would not use nuts. But this makes it, believe me, a really fabulous kind of, I put it in a brownie pan, and it goes from having 5.7 grams of fat to having 1 gram of fat, which only comes from the apple and the whole wheat flour and the beans, just as cell walls of those, no added fats at all for that recipe. So how do we minimize the holiday overwhelm? And hopefully with having less people over and less expectations for this pandemic holiday, maybe it will be a little bit better for us. But a sense of overwhelm can be really an FCS unfriendly eating trigger. So, you know, if you have FCS, or live in a family with a person with FCS, it's really important to take a look at keeping things as least stress as possible and set yourself up for success. And setting yourself up for success starts with planning ahead. It's getting things out of the way. It's making your to-do list. It's staying ahead of schedule, because if you have FCS, you never know when you're not going to feel good. You know, all of a sudden you're feeling poorly, and then that adds to the stress that you have. So prepare for the unexpected. There could be weather concerns, or hopefully not last minute company, because people should just stay outside and you know, to keep themselves safe. So ask for help. I think that's the hardest thing for someone with FCS to do, is learn to say no gracefully. You know, if somebody says, oh, can you bring this or that, or can you do this? Just, you know, practice no. Think about yourself and keeping yourself as low stress as possible. Realize that inappropriate eating is not going to solve any of the stress problems. And don't underestimate the power of a brisk walk to reduce stress. I mean, just being outside, seeing how pretty it is. I mean, for me, just looking at this picture makes me feel relaxed. You know, just that how beautiful it is with the fall leaves. Of course, we live in California. We don't have too many fall leaves here where I am, but just seeing that makes me feel good. And savor the true spirit of the holidays, which is friends and family, pandemic style. So this holiday is going to look a little bit different. Strategies for being a guest. So if you are a guest in someone's home, there's things you can do to help be sure that you're eating the foods that you should be eating. And we're going to go over this quickly, because this will probably be more of a thing in 2021 when everybody gets their vaccine, but because maybe you're not going to be going to someone's house to be a guest. But if you were, you would call ahead, ask what's being served, explain that you cannot digest fat for sure, and then sugar, you know, that part of it, you can decide what you want to do. The host may ask how they can assist you. Is it okay if you bring your own entree? That's probably the best thing. And now with the pandemic, people bringing their own food is a commonplace thing right now. Ask if you can bring a dish to share, and you make it something that you love as an FCS friendly appetizer, like fat-free hummus with a crudité, or a side dish, or maybe one of your gelatin salads. That's a good holiday thing. Take the edge off your appetite before you get somewhere. You know, some people will say, well, I'm going out, so I want to be careful and have, you know, some extra fat for the rest of the day. But really that sets you up for failure, because you're overly hungry by the time you get there. And then you have less resolve to avoid some of those, you know, high fat hors d'oeuvres and things. So a hearty fat-free soup, fat-free yogurt, having a half a turkey sandwich before you go, and a piece of fruit is always a good idea. And then you can relax and enjoy the company more. You don't have to feel like you're so hungry. Be sure before going anywhere, I'm sure you all are aware of your own state and local pandemic guidelines for holiday gatherings. Like here in California, they're telling us just to have to stay home if possible, and only enjoy the holiday with the people that you live with. If you're not going to do that, the most they suggest is having 3 3 households together, and some states are saying 5 people max. And but just know what's best for your area. If you're going to be a host, you have a lot more control. You determine the menu, you determine and you know what's in everything that you see on the table. Plan a special FCS friendly holiday dish that you really enjoy. And maybe this is something that you've been working on these last couple weeks. Serve festive holiday mocktails and just be sure to stay hydrated. If you're real busy and you're having someone over, you may be forgetting to drink. And that's why you ask for help. Get one special support person. Maybe it's your daughter, maybe it's a spouse, maybe it's a best friend, to be that person who's there to watch and be sure that you are taking care of yourself. That's the help you need, particularly during cleanup when you're more susceptible to what I call FCS unfriendly nibbling. And just send guests home with leftovers. If they're attempting foods that you think, that will be around your house the next few days, give them out. Let them go home with everything. Now we're almost to the end. Enjoy the true spirit of the holidays, spending time with family and friends. And we know this year it may be via Zoom, and it may be other ways of enjoying. We're going to try to do everything outside around a fire pit, and everybody have masks on. And maybe, it will be a little chilly even here in California, but it's going to be safer for everyone. And we're going to maybe have it in the daytime where it's a little warmer versus the nighttime. Take a nature hike and walk around the neighborhood to admire holiday decor, do a holiday carol, sing along outside, exchange homemade gifts, share memories of past holidays. We keep it's kind of like a big Santa cookie jar that I put out right after Thanksgiving. And anybody that comes over can write down the date and their little papers inside and, of their memories of the holidays. And then each year we can take those out and remember, oh yeah, remember in 2006 when everybody got, I don't know, a Cabbage Patch doll or whatever it was, that was a good memory. So we can look through past holidays. Family photos and videos are a great way of doing that, and trim favorite family recipes to create new favorites that everyone can enjoy, because there's no reason that your best, fat-free stuffing recipe isn't going to be the thing that everybody likes, or your last, I don't know why it's not going here, because I had my favorite pandemic, 10 pandemic. As I'm controlling. You guys do that? It says my internet's okay, good. Thank you. Thank you. There was a note that said my internet was unstable. 10 pandemic foods to keep on hand, and these are good for snowstorms and everything. So you want to have your pantry filled with lots of water-packed tuna and chicken breast, because those can be meals. The frozen Genio turkey breast is delicious, and it even comes with a fat-free gravy inside, and you could do it in the oven or in a crock pot. Ballpark makes smoked turkey franks. I don't think these, hot dogs are the healthiest thing in the world from many standpoints, but they do have 0 grams of fat, and they're good with some vegetarian baked beans for a backup situation, and they last a long time. Your fat-free cottage cheeses, your fat-free Greek yogurts, and all those things are good to have on hand. Fat-free egg substitute can be a meal if you're going to, make omelets and things like that for a meal. I don't know if you guys are eating those Kodiak cake. It's in the box that's in the back there in my little pantry section to the right on the screen, but they are 100% whole grain. There's 2 grams of fat in 3 pancakes and very low added sugar. But we're into these Kodiak cakes big time for a great breakfast. And if it's, a tough time, it could be a dinner too. Whole grains like whole wheat couscous. They have Good and Gather at Target, but I know they have the 90-second farro a lot of places, and just saute some veggies and mix it up with the farro and a little bit of your fat-free broth, and you've got a great side dish. If you throw some beans in it, you've got a main dish. Whole wheat pasta, oatmeal, Wassa crackers, and brown rice. These things are good to keep on hand. Canned low-fat chili beans. You know, if you lots of the chili is great. But just double check to be sure it has no added fats. Your regular beans, and then fat-free soups. Like I've been eating that Anderson split pea soup. I know for 30 years. So that Anderson split pea soup, the one, it's not bacon in it or ham or anything. It's just the vegetarian one, and it's absolutely delicious and a good lunch on a cold day. Fat-free tomato sauce and salsa. Popping corn stays around in your pantry forever, and just have one of those air poppers. Flavored rice cakes, and last, to have some frozen veggies on hand, frozen fruit, because these are the things that are going to run out, and then your ground turkey breast in your freezer. And you could be set up, if you have these things, you could be set up for a good month if needed, to keep yourself going and healthy during a time of tough to get food. So next, I think that's it. Let's see. Yeah, there we go. The FCS Foundation wishes you a safe, healthy, and happy holiday season. And these are some ornaments that are on my vintage aluminum Christmas tree. Thank you very much, and you all have a safe holiday.
Thank you, Mary. You always have
Thanks,
the best information, and even I'm over here taking notes and stuff. So great, thank you. So we're just going to go over the summary of our meeting. We're going to start to wrap it up and talk about our next steps. Next slide. So just a summary, what you can do. I'm going to be honest, I'm going to make a plea on behalf of Lindsey and I right now. I decided before I knew anything about what was happening with COVID to apply to grad school and go back to school. So I've been spending this semester finishing up my coursework for my license to get licensed as a mental health counselor. Lindsey is teaching full-time and also in school to get her certification for teaching. And the world is upside down as it is to begin with. So we need as much help from everyone as we can get right now. As I look into the spring and things with COVID don't slow down, and hopefully I'll be doing an internship. Lindsey will still be working. We love providing content and we love advocating on behalf of our community, but you know, we need as much help as we can get in order to continue to provide this content. So please reach out to us if you're interested in helping, and if you want to continue, if you have ideas or things that you want to see. You know, Lindsey and I are just kind of stretched thin, but we want to do more and we want your participation. Please, you know, look at the HEART Act, check out haystackproject.org, act now, fill out the form, let your congresspeople know that you want to see this passed, and that you support it and it's important to you. And have your family, you know, family members in other states or in other districts, send it to them, let them fill it out as well. Contact us to volunteer your time so that we can develop more programs like this. You know, Rare Disease Day is coming up, FCS Awareness Day will be around the corner. We definitely want to do the 5K again. COVID or not, there's no reason for us not to connect virtually to get some extra steps in and exercise in. So we definitely plan on doing that again. Providing content for Backpack Health, putting that up there, updating our social media accounts and putting content there as well. We really, you can come to us with an idea and we will say yes. Next slide. We do want to take a group photo before we all go, but before we do, I just want to see if there's any more questions. I'm going to scroll through, and you can feel free to unmute yourself now if you want to ask a question. I'm going to scroll through the chat as well and see if there's anything that we want to talk about, but does anyone have any questions? For anyone on our medical advisory board, for any of the industry partners that we have here today. Kodiak cakes are very good. And they make a mix also. They make like a muffin mix, I think, and it calls for oil, and I just substitute applesauce in the mix itself. And the mix is pretty low fat. So that's an option also. We had a question from Sandy about, looks like genetic testing. If I'm reading them, skimming it. Any questions for Backpack Health that we may have? No one. No. Okay. Well, we can take a picture. If I understand sometimes things have to kind of settle and think about it, and then you have questions afterwards. So we can provide any questions you have back to Mary if you have questions about diet, or to
Melissa,
Dr.
I think Yang's hand might be raised.
Oh,
Yang,
I
do you
don't
have
see
a
that.
question?
Okay. Yang, do you have
I'm
a
not
question?
sure. Nope. Okay.
I did just want to, sorry, Melissa, I did just want to thank a few of you I saw already joined Backpack. And thank you to Nick, who already contacted his local Congress rep. So thank you so much for that. It really helps us out. And I'm excited that you, and it looks like Sandy, and I think I saw somebody else say that they also joined Backpack already. So thank you so much for doing that. And they did it on this call, so it doesn't take very long, just a couple of minutes. So thank you very much.
Sorry, I think I was just muted. I have also, it's not really a question, it's actually comments about Backpack Health. And yeah, as Lindsey just said, the registration process is really easy, and it's very easy to find the Living with FSS group. I just want to add, could you please, Lauren, and on the group there are a list of a lot of contact information, but I don't think there's an email. If you can get it, maybe I missed it, but if I didn't, maybe we should add an email there so people can email us directly instead of going through just as an addition. So just one comment there, and I think that's very good, a very good job there. I'm already liking it, and I think I'm gonna upload my information there, so to assist me with my future doctor visits and things like that. Cool. That's it.
Thanks, Yang. I put my email in the chat there. If you want to email me directly, and then we can, of course, forward any of the questions that you have to the appropriate person. We really appreciate you taking time to be here, everyone. From Ionis, from Arrowhead, from Backpack Health, and then each of you on a Saturday. It's so nice, and it wouldn't be a webinar if I didn't get sentimental at some point. For those of you who have been on before, it's just so beautiful for me to be able to show Juliana all your faces, and as a parent, and just being resigned to the idea that this would be her very isolated life. It's
We lost her for a minute.
Yeah, I think we lost Melissa, but thank you again so much. And is it okay if we do get a group picture? And if you're not comfortable, feel free to turn off your camera. And Sarah, do you mind grabbing that?
I'll drive. Yeah, of course. If please, feel free to turn your camera off or on if you would like to be in the picture. We'll just do 3, 2, 1, smile. Cheers. And we can do a couple fun ones, maybe thumbs up or a heart. A heart might be nice.
Oh, heart's good.
If you'd like. Great, and hang on, great. Oh, so nice. Cheers. Very good, thank you. Thank you so much, everybody.
Hey, everybody.
Well done, everybody. Thank you.
Thank you, everyone.
Thank you.
Thank you for inviting us.
Fran.
Have a great weekend.
Happy Thanksgiving,
Thank you.
everyone.
Love your background. Hey, Fred.
Bye, everyone.
Bye.
Thank you.
Bye.
Sandy.
Bye, Melissa. Bye,
Bye,
Lindsay.
Bye. Bye, Mary.
Bye, Yang.
Bye.
Darlene.
Bye, everyone.
Nikki, Sandy, how are you guys doing?
It's been horrible with this COVID.
Yes,
You know?
God awful.
But I just had a new grandbaby Thursday.
Yeah,
So
Congratulations.
congratulations.
yeah, it makes getting old worth it, doesn't it?
Bye, guys. Thank you so much.
Bye. Thank you.
Thank you. Great job, everyone.
Thank you. Take
Bye,
care.
Mary. Bye, Chad.
All right.
Okay.
We are off.
That was such, okay, you could stop recording if you don't mind.
Oh, yeah, sorry.
Or can I? Maybe I can.